This is pharmacology, starting out with the beta-lactamase inhibitors and going through vancomycin and some others. Starting out here, we have the beta-lactamase inhibitors. Clavulanic acid or clavulanate is used in combination with amoxicillin, and this can be for either a gram-positive or a gram-negative bacteria. And a way to memorize this is I drew a picture of this cave, and in the cave we have some moccasins, and the moccasins have little smiley faces on them, so you can remember this is given orally. And if you remember, amoxicillin is an aminopenicillin, and it's also going to be for anaerobic bacteria. So I drew a picture of Anna, whoever that is, wearing a robe with the moccasins next to her in the cave. So remember that it's anaerobic. It's amoxicillin for the moccasins, and the cave is for clavulanic acid, which is used with that. Next we have Tazobactam, which is used in conjunction with ampicillin, which is another aminopenicillin. And for this one, since it's ampicillin, I have an amp here, amplifier like you plug a guitar into, and the guitar is playing some soul music, like blues, whatever. So ampicillin, Tazobactam, amp. Associate those two together. And again here, this is also anaerobic, so I have Anna wearing a robe who is playing the soul music on the guitar with the amp, or ampicillin. Next I have Tazobactam, and that's used in conjunction with piperacillin. And so to remember this is kind of weird, but I drew a picture of, this is Anna's pipe, and Anna's pipe for piperacillin, it's Anna's because this is also for anaerobic. Anna's pipe, it's a taser pipe, so this is a little taser thing on the end. So Anna has a taser pipe, and that way you can remember Tazobactam with piperacillin associated together. By the way, all of these are IV usage except for the amoxicillin, which is oral, and that's why I drew those smiley faces on there. Again, a reminder. Lastly, over here we have ticaracillin. So for ticaracillin is also used with clavulanic acid, and that's why I drew it next to this cave as well. So you remember that amoxicillin and ticaracillin are both used in conjunction with clavulanic acid over the cave. And you'd think maybe caveman, tigers back then, whatever. And looks like someone tried to shoot this tiger with a thing that puts animals to sleep. I can't remember the name right now, and that's why the needle coming out, to remember that it's used intravenously. Now down here I have Vancomycin, and this is not a beta-lactamase inhibitor. This is a new category here. Vancomycin, it disrupts the d-ala, which is I guess part of like I believe it's the cell wall in bacteria. And vancomycin is H2O soluble, and it is used for MRSA. Using it apparently can cause a non-allergy associated massive histamine release if it's given like too much too quickly or something like that. They call that red man syndrome. And it says here though to use it in high doses, and when it's with use in high doses. And you use it via IV unless it is for Clostridium difficile colitis. And so to remember this, I drew a picture of a van with mice, so for Vancomycin, and it's a first aid van for mice, so that's why it's got this big plus on it. That's to remember vancomycin is used for gram-positive infections. And this vancomycin apparently is slowly bactericidal, so I want you to imagine this van driving very slowly, and since it disrupts the d-ala, I have the la, the mice are singing. To remember that it's H2O soluble, I drew some mice jumping into the water and swimming around. And I drew over here, Mrs. A, or MRSA, has been run over, because this defeats MRSA infections. Okay, now over here I have Daptomycin, which is porin forming. That's how it apparently destroys the bacteria. but it's not used in the cases of pneumonia. And so the way that I remember Daptomycin is I have the tap, or the tap, from the tap. So this is water pouring from the tap. It's pouring forming. I don't know how you remember that's not for pneumonia. Maybe you think you don't drink tap water when you have pneumonia because bottled water's. I don't know how you remember that. Good luck. Okay, next we have Vancomycin, and the big thing with this is the black box warning. That is apparently to say you're not supposed to use that during pregnancy. This also disrupts the d-ala, very similar to vancomycin. It can cause nephrotoxicity. And for this one, I have, to remember it, I have a television for Tazobactam, and the music's coming out saying la la la, to remember the d-ala, and it's a black box television, and it's remembered not to be used during pregnancy. Here's a woman who's pregnant who's covering her eyes because she's not supposed to be looking at it when she's pregnant, and maybe these antennas can make you think of nephrons. I don't know. Good luck with that. Next, you have Fosfomycin, and Fosfomycin is associated with enyl pyruvate transferase. And Fosfomycin is only supposed to be for lower urinary tract infections. And so to help remember that, I drew a picture of a toilet, and someone's urinating into it, and it's forming fast foam, which sounds sort of like Fosfomycin. So fast foam in the toilet, I'm going to pee, and that helps remember it's urinary tract infections only, the fast foam, Fosfomycin. And I don't know about the enyl pyruvate transferase. I didn't really incorporate that into it. Maybe when you're transferring your pee into the, I don't know, whatever. Okay, next is Bacitracin. And Bacitracin is very nephrotoxic. It's not for systemic use. You don't put it into your bloodstream or anything because it would just shut you down. So what do you use for Bacitracin? Well, you can use it to coat things like maybe some sort of cavity or something if you're doing a surgery. So for that, I just basically put a person on their back, has this injury in their back, and they're tracing back tracing it with this medicine, Bacitracin medicine. Lastly, we have cyclosarin, which is a D-alanine analog. It's given orally, and it's an alternative for Mycobacterium infections. So I didn't really have any way to remember that one other than I just drew a cyclone or a tornado, and la la la, singing has a smiley face for oral. I didn't really have any good for that one.